Welcome everybody, I'm Maddie Gustafson and I'm a project coordinator here at NEHA. I'd like to welcome you to the EPA Smoke Sense a Citizen Science Project using a mobile app presentation. I'm also pleased to introduce you to Bailey Stearns. Bailey is a science communication and engagement professional at the EPA. Bailey?
Thanks, Maddie. Hey, everybody. I just wanted to introduce our speakers for the day. We have Dr. Mary Claire Haino, pronouns she, her, hers. She is an environmental health social scientist at ORD's Center for Public Health and Environmental Assessment. And our our first speaker, he will be going first, is Dr. Steve Prentz. His pronouns are he, him, and his. He's a behavioral scientist, also in EPA Office of Research and Development's Center for Public Health and Environmental Assessment. Now I will hand it over to our presenters, Steve and Mary Claire.
All right, unmute as first step. And I'll go ahead and try to share my screen, and let's see if the challenge of doing this correctly is something I can manage. Does that look okay for everyone?
Yep, we can see it.
Great. Thank you to both of you, Madeline and Bailey, for the introductions, and thank you everyone for the opportunity to speak to folks about our project. And before getting started, just want to say that, you know, our names are up on the screen, 3 of our names, but Smoke Sense is really a very large team project, and none of it is possible without the help of many people who you'll see at the end of the talk on our acknowledgement slide. But it really is a group that gets all of this work done. So for this talk, we're going to focus on some of the things we've learned about challenges and barriers that are related to health risk communication during wildfire smoke exposure and using our mobile app Smoke Sense. So there we go. We often say this expression, you know, we can't see the forest for the trees. And so this picture kind of shows you this problem. With smoke, here we can see lots of smoke in the image, but it's kind of that opposite of that common phrase. So smoke, we can see it, but we don't see all of what it's composed of, these tiny particles and gases. The forest has the trees right here. We can see the trees. So we kind of have a juxtaposition of our typical analogy. So this is actually one of our complicating factors. We're communicating about particles and threats that are invisible to the eye, and that really complicates when we talk about, you know, reducing exposure. This is a really basic challenge within health risk communication of air pollution and wildfire smoke. So unpacking this a little bit further, why is it a challenge? Well, invisible risks, things that we have a delayed response, things that we don't, we find it difficult to establish self-efficacy and to get a good handle on risk perception, just make life more challenging for us. So within smoke, one of the primary air pollutants we focus on is fine particulate matter, so PM 2.5. And this is really of the highest concern for human health. EPA concluded in its evaluation of scientific literature on effects of air pollution that there's a causal relationship between both short-term and long-term PM 2.5 exposure and cardiovascular effects. There's likely to be a causal relationship between both short and long-term PM 2.5 exposure and respiratory effects. And that's from 2009, and sort of the research is ongoing, and more links may be found to other chronic diseases. And so we know this is a potent pollutant. So, you know, exposure is linked to things like cardiovascular disease, premature death, increased respiratory symptoms, irritation of the airways, coughing, or difficulty breathing. And this image here is really showing you the scale, the size of these particles. They're tiny. We've got the human hair as the reference related to the grain of sand. And then within the blue dots that are 10 micrometers, these little pink dots that are kind of around that circle there, those are the size of PM 2.5. So we need a microscope to see it. Another complicating factor, when we report air pollution, it's in terms of weight per unit space. And so the analogy I like to give here is that, we talk about things like 30 micrograms per cubic meter or 100 micrograms in, more extreme events. A paperclip weighs 1,000 micrograms, and a cubic meter is about the size of a box a dishwasher might ship in. So that's another framework to think about in terms of the quantities we're dealing with. It doesn't take a lot of pollution to have a big impact. Okay, so we've talked a little bit about the problem from the pollution standpoint. How about from the wildfire smoke standpoint? Smoke from wildfires has been estimated to be the leading cause of exposure to acute levels of poor air quality in the US. And kind of with each year, you can see on this graph, there's more acres that are burned. Fires have become more intense than they've been in the past. Other risk factors include housing that's being built closer to the interface with wildland. So that puts more of the population at risk. We've got more of that population that's sensitive, including children, older adults, those with cardiac and respiratory and other chronic diseases who are more vulnerable to health impacts. And so here on the right of the slide, I'll point out, we've got this pyramid that kind of speaks more to epidemiology. And in epidemiology, we tend to capture the top of the pyramid, these most severe effects. So we can keep track, we have good records and good data for things like death and ER visits, hospital admissions, heart attacks. And as you work down the pyramid, there's a broader segment of the population that is affected and that's experiencing less severe effects. But we do know that these effects are potentially precursors for those more severe outcomes. So we are interested in kind of understanding as we're affecting the broader swath of the population. So I hope in that kind of introduction that zoomed through a lot of stuff, but we try to make the case that smoke is a potent health hazard and provides challenges for health risk communication. And our goal is really to try to improve outcomes. So, what are the ways that we might do that, and how do we think about smoke sense and how smoke sense can address these challenges? So with health risk communication, one of our roles is to motivate specific behaviors. So for wildfires, some of these desired behaviors can include very specific actions to reduce your exposure. These can be things like wearing a respirator mask. So I've got my N95 here. Buying and using a HEPA filter at work and at home. Responding in a timely manner to health recommendations. Controlling your sources of indoor air pollution, maybe sort of under one that's not thought about as much, right? But things like cooking or burning candles. And then finally, reducing time outdoors. So this one tends to be a little more obvious for folks, but it is an important one when conditions are really bad outdoors. So, we're trying to communicate these basic actions, but we've got a kind of unique and maybe odd, unusual context, and the circumstances can make this more difficult. So we've got varied effects, varied populations. We've got time and severity that's variable, rapidly changing environmental conditions, and there's actually multiple types of behavioral responses. So sometimes the conditions can dictate what the best behaviors are that people should be engaging in. So very dynamic situations that wildfire smoke presents for us. So when you put all of that together, this is a big ask from the perspective of a communicator, as well as the perspective of the individual who's receiving the message. So how do we think about it? You know, if we want people to take action, we want to take actions ourselves. We have to make the decision to take action. And we want to think that we're objective and we're rational, but a lot of the time we have motivations, we have biases, and just things that can override and influence our decisions. As I mentioned before, this can be complicated by the complexity of the situation, unfamiliarity for a lot of people, sense of a lack of control or lack of accessible and available evidence, right? Why should I do this action that you're telling me about? I don't have any evidence that tells me I should, you know, think one way or the other. And so one thing that we want to try to think carefully about is habits. And to give an example of a sort of public health adjacent or public health related problem where people used to not have a habit. In the early 1980s, fewer than 15% of Americans said that they wore seatbelts consistently. Over time, we as society have grown more comfortable with the idea of seatbelts. And now when you ask people, more than 90% say that they regularly buckle up. And so when you look at data and some of those things, you know, top of the pyramid sorts of outcomes, you know, fatality rate for motor vehicle crashes has dropped over time. And so of course the other vehicle safety features have contributed to this, but that simple action of buckling up has made a profound difference on these worst outcomes. And there's probably also broader benefits that we might not capture in the data. So, you know, we think that's a relevant example of something that has become habitual that we don't really give second thought to, but that has evolved over time. And that might be sort of an arc or a trajectory, and hopefully we can try to move people more quickly than that seatbelt example. So back now from that little veer to the Smoke Sense citizen science story. So we're really trying to contribute to the evidence base about improving health risk messaging and reducing public health burden. And at the core, we want to promote issue engagement, education, making a personal connection between these environmental changes and our health, raising that personal awareness about the salience, the importance of changing your behavior during smoke events. And so our central component of the Smoke Sense initiative, we have broader components and additional projects, but the mobile app that we'll be talking about more in the upcoming slides is really the main crux here. And so with the mobile app, we try to take an iterative approach to knowledge building. So every year we try to review what we put out there, what are key elements that we want to work on for the next season, how can we make it better, how can we deploy a better product, you know, in upcoming fire seasons, and how can we reach people with the information that they need and when they need it. And so just a brief timeline, we We started in 2016. We had a kind of pilot season. We made some changes. We started kind of small with about 5,000 participants. And each time we relaunched, we were finding we're gaining more and more participants, to the point where we now have about 50,000 people who have downloaded. We've added new modules, as we point to in the text box here, things that are highly interactive, like quizzes and aspects that try to get at gamification or engagement with the app, where people can interact in that unique way. We also want to provide people with more kind of direct information. So the what can I do module is really, kind of just the facts. So click through and you will learn kind of step-by-step, bullet point by bullet point. Here are the steps you can do. And we try to present that in a really clear, clear manner. And as we move forward, we're going to be making changes to some of the ways that people can report their data, the frequency that they report, and the way that they interact and the way that they receive some of their data summaries. So we like to say that this is citizen science in the palm of your hand, and hence a picture of all of us with the phone in the palm of our hand. So who can participate? We try to make it really democratic. If you've got a smartphone, if you're interested in smoke pollution and you want to contribute to understanding health impacts. We do, give a consent that people are above the age of 18. So we want to not include minors, and that's just, part of our disclaimer. And in fact, the only data folks have to provide is their zip code, and that's to get some of our features about air quality and mapping. And like I mentioned before, this is an iterative process, and we hope that participants gain knowledge, information, but they're also providing the backbone for us to continuously improve our messages, to think about behaviors, and ultimately to improve those health outcomes. And so just going through some of the specifics of SmokeSense now. So as I mentioned, people can access information about air quality. You can see that in the figure on the left. They can explore their current and future air quality. They can learn about fires, the status of fires. They can engage with these learning modules, and they can report their observations about smoke and also the actions that they take in response to smoke. We do have users in all 50 states, and as I mentioned, we're up to about 50,000 downloads. And really, again, just hammering this point home, we want to reach people. We want these resources available to people when and where they need them. And so, diving a little deeper into what people learn and why we did some of the design features, we tried to consider aspects that would increase the opportunity to build new habits, so that when you come here to this dashboard and you learn about air quality, we want to give a good explainer in terms of what is this dial that I'm looking at, what is the meaning, and you can drill down through these help menus and try to get a good sense, like on your first pass, and then it's always there as a reference anytime you need it again. And then, springboarding off of this, we want to improve literacy. So hopefully you've come to the app and you've learned a little bit about air quality, and then you might be interested in looking at what can I do, and that module, and thinking about the educational games, and brain teasers. And from there, people can jump and look at this map. We think visualization is really important to help make some of those threats that are invisible, really make those more salient. So some of us might have, in fact, experienced air quality impacts from fires that are really far away. In fact, this smoke season, a lot of transport, long-range transport of smoke was happening. People might have had different color, of the sun from the impact of smoke, or they might have had, really bad changes in their air quality. You can see here at this map, in the Midwest, in Minnesota, folks have gotten a kind of double whammy from fires in Canada as well as fires in the US. And so depending where you are, kind of seeing that trajectory of the smoke can be really important. Seeing where it is currently, but also more importantly, seeing where it's forecasted to travel and try to help people prepare for the changes that might be coming to their environment. So that's sort of what folks can get and what they can learn, and now to what they contribute. So our participants are sharing data, but we also think they're gaining, hopefully, an understanding of that connection between their environmental conditions, the actions that they take, and ultimately their health. So in our soon-to-be released version, we're going to focus more on when people take these actions and how many actions people take, or in some cases don't take, right? So people might be putting off actions, and we want them to know perhaps some of the benefits of taking earlier actions, not putting off some of those things that they might have been putting off. And another really critical aspect that we try to build into the app is a social comparison. This idea of, what is normal? What are other people doing? So we try to have a really robust and rich set of data to share with people, summary screens of, here's what other people are experiencing. Here's the actions that they've taken. And so you might start to see what's going on in other communities that are impacted. What are other folks doing? Should I be doing more? Look what else is going on, right? And so a lot of behaviors that we engage in, we rely on looking to other people and getting that sense of what's normal, or what's, in this case, the environmental conditions might be abnormal. So we need to adapt to a kind of new normal. And then to further supplement this, we try to put even more data in an online portal or online playground where people can visualize and even interact with the data in deeper ways and see more of the data. We're kind of limited with the screen that we have. Like I said, we add new features and new capabilities, but we may get even more flexibility with this kind of web-based interface where we can give people kind of 50 state views and let them dive into the data a little more deeply. Okay, so last thing that I'll mention is I've hammered this point a little bit, but our interactive features, our quizzes, these are what we think will help people. We give them a hypothetical situation. We give them a kind of, quiz. Let me think about this. And part of it is to get them familiar with it, but part of it is also just to give you that preparation. Maybe you haven't had the real world situation yet, or you haven't thought about that particular scenario. And now, we challenge you with a question, you've thought about it, and you find yourself in that situation, and you may be able to think back to that hypothetical scenario we put you in, and maybe that helps to push you just a little bit closer to taking action. And so with that, I will turn it over to my colleague, Mary Claire, and I'll keep sharing the slides, and just let me know, Mary Claire, when you want me to advance, and I will put myself on mute.
Thanks, Steve. Hi, everybody. My name is Mary Claire Haino. I'm an environmental health social scientist in EPA's Office of Research and Development, and have had the pleasure and joy of working with Steve and the rest of the Bailey and the rest of the SmokeSense team over the past few years. And so I'm going to take the second half of the presentation and share a little bit about some of the findings that we've gotten or that we've learned from the SmokeSense SmokeSense data, and then kind of give some insights into kind of the types of questions that we're asking, but also where we're going and in the future. And so we titled this slide "Citizen Science Meets Social Science," and what we mean by that is, there's different types of citizen science projects, and our SmokeSense is really aims at promoting engagement with existing scientific data, as well as action. We want to see people, and we hope that by using the app that there are, Steve mentioned issue engagement, that folks are starting to kind of think more about what their air quality is and the relationship between their air quality and their health. And we're hearing a lot of, we've heard from both partners as well as individuals who are participating, that even just having the questions around and having the opportunity to report things around air quality and the impacts that air quality has on them personally has increased their awareness, and that's just one of the first steps in taking actions to reduce exposure, which at a population scale will help move the needle on reducing the public health burden of wildfire smoke. And so, over the next couple of slides, I'll share some findings that we've learned from the SmokeSense, some of the earlier seasons. And the questions that I have up here are some of the questions that we were trying to understand. So in addition to kind of the basic, like who's using the app and kind of like what kind of profile are they, we wanted to know, like, when smoke comes, how do participants or people who are reporting, how do they experience that? And closer to real time. So not necessarily looking at that epidemiological data where we can see associations, at the, like, maybe 5 or 6 years down the road, but what are people, how is this impacting their life? And then as an individual, when it happens. We were also curious, what are people doing when there are smoke events? What actions do they take, and when do they take them? And what are some of the motivating reasons why? How are they thinking? What are their perceptions? How do they relate to this threat of wildfire smoke? Do they even consider it a threat? Is it a serious concern? Do folks have a general overall knowledge and basic understanding of the relationship between wildfire smoke and air quality and health effects? And what kinds of tools or techniques do they have access to that can help them reduce exposure? And then again, some more insights on their thoughts and perceptions around the different kinds of actions that are recommended. We have our standard suite of actions that like most agencies kind of share, like for reducing exposure, but we don't know a whole lot about what people actually think of those. And then finally, some of the barriers. So looking to understand some of the barriers to taking action. Next slide, please. So here, this is a snapshot of what people are reporting in terms of the health symptoms that they've experienced. And so, thinking back a few slides to that health pyramid that Steve shared, where the very top of that pyramid, the smallest box had the most extreme outcomes. So that was death and associated with smoke. And so it was at the top because it was very extreme, but only a small only a small percentage of the population actually experiences that type of outcome when they experience smoke. And so kind of thinking here we're seeing that most people are reporting kind of stinging, itchy, watery eyes, scratchy throat, sinus, subclinical things that you may not necessarily present to your healthcare provider about, but that still have an impact on you if you have, you know, irritation in your eyes and nose and throat. And so we're seeing kind of the majority of folks are reporting these subclinical effects, and far fewer are having the more significant impacts, which maps onto what that pyramid suggested. And so when we think about, you know, all of this, we're trying to then also translate it into health risk communication and communication guidelines. And so we're looking to try to, how do we, you know, what can we do to meet people where they are in terms of what their symptoms are, and helping them to think through what does this mean in terms of the kinds of communication that we're putting out there, and how do we link that communication to these symptoms that they're experiencing. Next slide, please. So most participants, like 90%, responded by taking at least one action. Many of those seem to have low barriers. So if you're looking across the top 3 choices, keeping windows and doors closed, staying inside, maybe reducing your normal outdoor recreation, not going outside for your regular walk or exercise, or, you know, limiting outdoor playtime. But then you start thinking about the choices in kind of the 40% range. And here we're seeing, like, you know, only 40% or so reported using an air purifier with a HEPA filter, or, you know, reducing, like, making changes in terms of work or school, or reducing indoor air pollution. And then many fewer down at the very bottom are actually reporting going to their doctor, having an unscheduled doctor's visit. So it's you know, the majority of the kinds of things that people are doing are these lower barrier, easier type things to do. And if the chances of actually having to go to the emergency department, or you know, go in and have an unscheduled doctor visit are very low, then that may influence some of the perceptions. So how we think about the risk of this event for ourselves, because it may be that we don't actually think that the health outcomes that we all experience, that Steve was explaining earlier, that may be that big of a risk, or important for us to consider. Next slide, please. So here, these figures illustrate the likelihood of taking action, and that the likelihood of taking action goes as the number of days that we experience symptoms go up. So we have 2 similar graphs. One on the left is for across all participants, and it's not stratified, so it's all participants, and not looking at just participants who reported a certain behavior. And with every curve except the no behavior, the one on the very bottom, every curve it goes up. So the likelihood of taking action, any type of action, goes up the longer the more days that we have are experiencing symptoms. And so the difference between the one on the left and the one on the right is that the right, we've stratified participants by those who reported seeking medical attention. And we see, like, the likelihood of taking action is the curves are much steeper. So the longer that they are experiencing, those who reported seeking medical attention, the longer they're experiencing symptoms, the more likely that they're going to take some kind of action, and that demonstrated by those steep curves. And so what this tells us is that that people are tending to take action to mitigate behaviors in response to their symptoms, as opposed to before they start experiencing symptoms. And what we hope, and what we're kind of working towards, is to try to flip that, so that because we don't, we as in just people who are part of this community of of other people in the world, like we want our work to try to help prevent some of these adverse health outcomes that we know are associated with exposure. Next slide, please. So kind of what we're seeing, and overall, and kind of zooming out a little bit. So I talked about kind of what people are experiencing, the kinds of actions that they're reporting taking, when they and why they're taking those actions. So in response to symptoms, so after they start as opposed to before. And we also have insights on their perceptions around the overall risk, and we just, based on the number of participants that we've gotten over since we've launched the project and the app, I mean, it's very clear there's a strong demand for understanding information about air quality during wildfires, and that what we offer now is the spatial, like the available air quality data. Like what we're hearing from folks is that they are looking for even finer grain information about what the air quality is, and that is kind of reflected in what we're seeing lately with some of the temporary and personal air quality sensors that have come on the market over the past 5 or 6 years, kind of the explosion in interest and growth and use of those. We also learned that participants very clearly recognize smoke as an exposure, like something that, like, being exposed to smoke was a health risk. And most people did something, they didn't just kind of stand there. And that kind of skipping to the bottom, while they understood and recognized that this was a health risk, we saw that there was a lot lower recognition that there was a risk to themselves, like a personal health risk, and we came to that conclusion based in part on the graphs that I was showing, that there wasn't, but they didn't recognize that it's a big enough risk in order to prevent the exposure and prevent the symptoms from happening in the first place. Next slide, please. So we want smoke sense to be something that motivates and prompts change at the individual level. So like I said earlier, trying to get folks to think about and engage with scientific data, and also take action to help reduce their personal exposure and lower the risk of their adverse health outcomes for them. We also want this project to support and inform broader initiatives and kind of recognizing this bigger picture work that's happening at the national level, and a big part of that is health risk communication. And so some of the data and what we're hoping to speak to are health communication messaging. And so you may have background or learn about principles of communication and guidelines of communication. And the very first one is get to know your audience. And so, thinking about getting to know your audience, we were curious, what are the different perspectives on smoke, and is there a globally kind of shared perspective of this among participants, or do folks see things differently? And here we identified a typology of sorts of 5 different groups. And so we did some cluster analysis based on the items that I've listed on the left side of the screen. So, personal health assessment, access to exposure reducing resources, previous experience with wildfire smoke, perceptions of smoke as a health risk, efficacy, like an individual's self-efficacy for being able to actually reduce exposure, and then perceptions on health risk communication and their information needs. And we found that the participants tended to clustered in these 5 different areas, or 5 different groups of people. And they're those who were we had some that were rather unengaged. These folks were young, healthy, they had very low risk perceptions, and we had Others, you know, we have the cautious. Those were like who they, you know, were likely to benefit from health education messaging that links to symptoms, or that links exposures to symptoms. So, you know, these were generally healthy, but like had some health concerns and were looking to try to understand what that meant, like open and willing compared to the unengaged. And then, you know, the proactive and the susceptible, folks that maybe have higher health, like better health quality, and we're looking to try to keep that. And then the susceptible, you know, tended to be lower in health, but were very interested in, had recognized themselves as in one of the, you know, vulnerable population, and we're looking to try to try to understand like what all of this means for them. And on the very far side, we had the protectors who were looking to like really like move on this and do anything they could to reduce their exposure. And we mapped these to the precaution adoption process model here to try to understand, okay, so if we want to try to figure out who is our audience, and we've identified that there's these different clusters or different groups of people, what kind of messaging might resonate with them, and we put this on this model because this is a well accepted, you know, public health model for health behavior, and we put it on here because we thought, okay, well, we want to know like what kind of messaging might we want to share with these folks based on where they are in terms of their recognition or like their ability or interest in heeding health recommendations. Next slide, please. So here, you know, we just to reiterate, understanding these perspectives can help inform our health risk communication. And so individuals kind of who are at greater, what we're seeing, you know, additional insights that those who were at greater risk were also the ones who were engaging in the interactive features. But kind of looking across all of them, we've come up with some ideas for the kinds of message content that may be important to share for different folks. And so those who like are interested in protecting their health, really thinking about messaging that underscores self-efficacy for reducing exposure. So this is something that you can do, and kind of nudging them towards action. So pulling in that behavioral psychology that Steve was mentioning on, like, they don't need to know why, and they're on board. They just need to know when to act. And you know, then thinking across these other ones, these other groups, so cautious, like really kind of linking exposure with subclinical outcomes. So helping them understand and really make that mental connection between like there's smoke outside and I'm also having these effects, and they're connected. And so there's something that I need to do. With the proactive, like emphasizing that this is exposure is a risk to maintaining their health. And then, you know, with the susceptible, it's more like kind of underscoring the agency aspect. So they're contextualizing this as something that's modifiable, that it's not, it's not a given that they must, you know, that they can't do anything about. And then finally, with the unengaged, this is really, we thought, you know, emphasizing and underscoring like this, like the potential impact that smoke has on the other aspects of their daily life. So, you know, if they're younger and good health, not really like in the age group where they're getting screenings for random things yet, it really kind of helping to emphasize the other parts of their life that smoke exposure might impact. Next slide, please. So, let's see. I think this is, we wanted to circle back for the last couple of slides to the smoke smarts that Steve mentioned, and tying that into some of the health risk communication content that we think would be applicable and useful going forward. So here we have, you know, in Smoke Smarts is one of the interactive features in the app, and it asks us and gets us to start kind of thinking bigger picture. And so what we've seen in these data is that 90% agree. And we ask people kind of what do you think we should do, and then how many like what do you think those who are vulnerable should do, and then how many people do you think actually do this, or what percentage of people do you think actually do this? And there's a pretty big gap in terms of what people thought, like what we should do, and what people actually do. And so that tells us that the messaging that we're getting out of, like, here's all the things that you ought to be doing, is coming through loud and clear. But it kind of reinforces those insights earlier, that dissonance between understanding this as a risk versus applying and understanding that risk to them as individuals. Because there's kind of a 38% gap between what they think people ought to be doing, and they think that far and fewer people are actually doing that. Next slide, please. So a little bit more on what we learned in Smoke Smarts. We've also asked folks their likelihood of heeding different kinds of advice. And so, we asked them about all kinds of things that were recommended. And we see that this was pre-COVID. These are pre-COVID data, just so when we talk about respirator masks and things like that, you have context for it. There's very high likelihood that people are doing things like using recirculate, or keeping the windows closed, or actively managing their asthma, compared to what we also saw in the reported data of low likelihood of doing things like going to a health professional and talking to your health professional about that. Kind of related, we also asked them about different kinds of barriers and the types of barriers that may come up. And so here we've highlighted 3 of the top barriers that people were identifying, and things around cost and forgetting to actually take the action, and then not really understanding or perceiving the benefit. So with cost, examples of like purchasing an air purifier that has a HEPA filter, and those things they're not inexpensive, and can be a significant purchase. Or like visiting a doctor if you don't have an asthma management plan, and like going to seeing a healthcare provider takes a lot of time and money to actually go and get that done. Then other things like not quite understanding like how a respirator, the efficacy of a respirator, or how much like benefit you get from doing things like keeping the windows closed, or using your recirculation in the car. And so there's this interesting kind of disparity in likelihood between asthma and cardiovascular health, and that like there's this kind of, we're seeing the important things are like an informational gap in what folks are sharing, or what they need. So seeing the asthma management, like folks kind of understood that, but they weren't sure about like the benefit of taking these actions in terms of protecting cardiovascular health. And one of the things, like I said, is pre-COVID, so we're looking to see kind of how responses to these items have shaken out post-COVID. But next slide, please. Looking at kind of the gap that I mentioned between what people should do and what they think others actually do, that could inform some of the health risk communication. So thinking about at the individual level, health risk messages that can help increase personal relevance, so focusing on health factors and outcomes that individuals can identify with, as well as looking for sharing compelling evidence that behavioral change is beneficial. And then I'm just going to end with the last slide. And here we've kind of, Steve shared a little bit about what the issue is, what Smoke Sense is about. I gave a quick run through of some of the findings that we found over the past 5 years, and collecting those data and analyzing them. I'm trying to tie it with kind of what we're hoping to see at the individual level, but then the kinds of application and utility of those data that we're translating into higher order change initiatives. And it all kind of comes back to these communication challenges related to wildfire smoke. And so here on the screen, we began to identify a number of challenges that we think are kind of the next steps for us and for this research, but not just us, but kind of the issue more broadly. And we're hoping that, that are continuing this work and then working with our partners, that we'll be able to continue to support, broader efforts to increase the effectiveness of communication messages and, strategies for improving communication out and platforms and content and strategy outreach. So kind of ran out of time there. So I'm going to turn it back over to Bailey and Maddie, and then also to Steve, and we can happy to answer any questions or take any comments.
Great. Thank you so much, Mary Claire. This is an excellent presentation. And it looks like we have about 4 minutes left. I don't have any questions in the chat, but I do have a question for you and Stephen that I have. And I just am wondering, what are the next steps that you have for the app and any goals that you have moving forward? I know it sounds like this has been a several-year thing. What's next?
Okay. So we have this year we're releasing the latest version should be coming out hopefully this week or next week. So that's coming up soon. And one of the cool things that we've been able to do with SmokeSense is learn from each year's reports and observations, and then adapt the app both in terms of the user interface as well as the reporting form, so that we can continue to meet people where they are, as well as look into new research questions that can help us better understand and try to support and improve health risk communication. And so for this year, in addition to making some changes to the user interface, we're also including questions around better understanding the differences in risk perception, as well as like communication, how people who are experiencing smoke are communicating about that within their personal networks. And those findings, I think, will one, support more direct communication, and then two, help us and partner agencies understand who the repeaters and amplifiers are of the health risk messaging, who those people might be, so that we can not only message to their needs, but then also help support them in sharing the kinds of information with others who may not be directly receiving or accessing some of the risk messaging content.
Okay, great.
Yeah, thank you so much.
Yeah, absolutely. One more quick question before we jump off. I know we have a few NEHA members and environmental health professionals on, and others that are going to be joining the recording. Any best practices or any recommendations on how they can share that with their platforms and with the public as well?
I don't know if Steve is about to
Looks
talk,
like,
but I can talk.
Okay. Problem.
Yeah, so definitely we have a website. The app is freely available on both iOS and Android-based phones. So in the Google Store and the App Store, and so you can download it freely through either of those app stores. And of course, always reach out to us. We have our email addresses are up here, as well as you can contact us through the website. I think Steve got off mute, so I didn't know if there was anything else to add.
I was going to say Bailey is our communications guru, so.
Yeah, I was going to add real quick that on the website, there's actually a page with resources, and on those resources, you can see some draft social media that you could potentially use on your own social media platform that talks about SmokeSense, as well as some widgets that if you wanted to add to a website area, you could do that as well. And I believe there's also a bunch of FAQs there if you wanted to ever share if anyone had questions about SmokeSense. There's a whole area of FAQs that you can check out in case there are any issues that you're having that maybe someone else has already had and we've answered in those FAQs. And then I wanted to let you know that we frequently share on our social media at EPA Research on Twitter about SmokeSense pretty frequently. So always feel free to retweet us there.
A little Twitter plug. I love it.
Twitter plug.
Yes. Great. Thank you so much, Mary Claire, Stephen, and Bailey for joining us, and everybody else that was attending. a really great presentation, and hope to see you all sometime soon.
Thanks so much. Take care.
Thank you.
Thank you,
everybody.
Maddie.
Bye.
Bye.
Thank you.